One bony landmark is the medial epicondyle, and it is located on the medial aspect of the elbow. Prominent little ball figure we feel right here. Next is the lateral epicondyle of the elbow joint. You're gonna flex the elbow joint, and it's gonna be on the lateral side, and it should be this rounded edge right here. The third bony landmark is the olecranon process, which is part of the ulna. You're gonna flex the elbow joint, and it's gonna be the tip of your elbow. Next, we have soft tissue palpations. One of the soft tissues is the brachioradialis. Have the subject act as if they're gonna shake someone's hand, and they shake it, and you should feel the brachioradialis around this area. There you go, check it. There you go. Next, we have the ulnar collateral ligament. It's located between the olecranon process and the medial epicondyle. If you palpate it, you shouldn't feel anything too prominent, but it should feel like a bundle of ligaments there. Right here. Next, we have the wrist flexor and extensor group. The wrist flexors are going to be located on the dorsal side of the forearm, and they're going to attach to the lateral epicondyle. So they should be here. And the wrist flexor group is going to be on the opposite side, and they're going to attach to the medial epicondyle. One acute treatment option is to have the patient put a wrist brace on. This limits the amount of wrist flexion. The second acute treatment option for medial epicondylitis is to apply ice at the pain of sight for 15 to 20 minutes. Long-term treatment option is physical therapy, and one of those exercises would be grip strength. Have the patient get a ball or some socks and have her grip it. Second acute treatment is wrist stretch by slowly bringing your fingers posteriorly and slowly relaxing. Next, the shoulder joint. One bony landmark is the clavicle, which is prominent on the neck. And it starts from right here, and it goes all the way to the tip of the shoulder. The other bony landmark we have is the sternoclavicular joint, also known as the SC joint. It is articulation of the sternum and the clavicle. So it's right here, and on the other side, it's gonna be right here. One soft tissue is the biceps tendon. If you have the subject flex the elbow, you're gonna feel a rope-like structure right here. And I feel it right here. Sling technique for shoulder injury. We're going to use a regular t-shirt and put it over the head and fit the injured arm in the bottom of the shirt and through the armhole.